Hello guys, we're Group J. We're reviewing Bynum Chiropractic, and my name is William Falk.
I'm Garrett DeMeyer.
I'm Leslie Keeney.
DJ Perkins.
I'm Mark Paz.
I'm Guillermo Vasquez.
I'm Adrian Navarro.
Good morning, Tri-Six. I'm here to give you a brief introduction about Dr. David Bynum. Dr. David Bynum owns a successful chiropractic office called Bynum Chiropractic in Addison, Texas, and has been named the favorite chiropractor by Addison Magazine for 2 years in a row now. He's become he's become so successful and efficient that he has had to open up another office to take in the overflow of patients. He's a Parker University grad and has been involved and around chiropractic for a very long time now. His love for chiropractic began after he experienced an accident from snowboarding and severely injured his neck. Chiropractic was able to help him through the process of recovery, and his love for chiropractic and philosophy shows through his demeanor and the way he incorporates it into his practice. Dr. Parker's philosophy into his practice is that loving service is my first technique, and is certainly displayed through Dr. David Bynum's demeanor and the way that he treats his patients. He understands that each and every patient that comes through his door is an individual and is uniquely different from the person that comes into his office from the last. He believes that there are many things in his life, such as stress or accidents, that occur and cause the body to react with the subluxation.
Dr. Bynum welcomes a wide base of clientele from infants to seniors, and due to his wide range of techniques that he uses in his practice, he's able to easily treat each and every patient that comes through his door. Dr. Bynum is certified and utilizes techniques such as diversified, SOT, upper cervical, specific prone, tension to tone for frozen shoulder, cranials, extremity care, and lastly, Webster technique. The use of Webster is heavily utilized in his office. He uses low force adjustments, which makes him able to treat all kinds of people and provide longevity for his own body. Webster technique is particularly important for Dr. Bynum in his practice since he runs a family clinic. This is a crucial technique to know so that he's able to utilize it during the pregnancy of his patients. Webster technique is a safe and efficient way for adjusting expecting mothers, and it has shown to help with fetus positioning. This is not a technique for repositioning a breached fetus, but with adjustments and treatment, it is possible for repositioning of the baby to occur. The great thing about this technique is that it can be used on other people, not just pregnant women. And it involves an adjustment of the sacrum, and secondly, assessing the ligaments and the musculature of the pelvis and correcting them back to a normal tone. He strongly advises for mothers to get adjusted during pregnancy because of the trauma that they will go through during pregnancy, and then also post-pregnancy with the trauma they experience during birth. He also strongly believes that the baby should receive chiropractic adjustment after birth from all the trauma they go through. Correcting the children early with continual chiropractic treatment can help benefit the infant in all aspects of their life for years to come.
Dr. Bynum's primary location is in Addison. It's roughly 1,200 square feet. He currently has that as his established office, where he has 2 CAs behind the desk working at all times. His new patient procedures are he has a patient that comes in, they have 6 pages for them to fill out, involving everything from their previous medical history, the initial complaint, to the review of systems. That is then followed by the patient being taken back to get x-rays. This is done by his CA. Once that is done, then they are sit in a holding area or one of the waiting rooms. At this point, then Dr. Bynum will be cued. He'll come in, he'll go ahead and do his 30-second scripted speech of what the findings are for the x-ray. And then from there, then he will adjust the patient and do orthos and neuros for this first visit. That usually consists of a 7-minute time period. After that, the subsequent visits are done within 3 minutes, and that's going to be adjusting the patient and any further analysis. He currently has incentives for his staff to help him meet his monthly goals. He also has a unique pink card for his patients that they come in, that they're going to come in, they're going to swipe, which will also let him know where the patients are currently in queue. His marketing, he does no marketing at all. It is done through personal word of mouth. And his overhead, he has a very low overhead at 18%. He has $1,600 that was his monthly rent that is also going to include the build out, which he has extended that contract for the next 5 years. And then his salaries for his current CA are the 18%, and he has $800 a month that he uses for his digital imaging.
Hi, I'm going to be talking about Dr. Bynum's second practice today. It was originally opened because of his overflow of his vast amount of patients that he's seen per week. It opened in July of 2018. Basically, it's a little more progressive than his first practice. It's got an open bay style with 3 different adjusting tables. It also has a intersegmental traction table in a separate room, and then there's a third room that has it's a private adjusting room if he needs to adjust somebody in a more intimate setting. It's run by his wife Jessica right now. I don't think that's the plan long term, but that's who he trusts and who's running the show right now. It's about 1,400 square feet. It's a little bigger than his first practice, and it's running great, and that's it.
Recommendations we wrote down for Dr. Bynum's office was the disadvantage in chiropractic everywhere is insurance paying less for adjustments and limited amount of visits they can pay for. So an alternative would be to switch patients over to a cash payment plan, so insurance doesn't dictate costs or number of visits. And another way he can grow his practice is to add a physical therapist or occupational therapist to his team. That way they can help with patients for daily living activities such as dressing themselves or eating. Dr. Bynum loves to serve pregnant women and babies. So a better way to serve them is to do house calls to moms that can't make the drive. If Dr. Bynum also wants to treat the patient as a whole, he could give nutritional advice to them to make them be healthier as a whole person. A great way to keep in contact with current patients is to have a mailing list of all his current patients and send like weekly or monthly emails, just a certain health topic that they'd be interested in. And then a great way to serve the word about chiropractic is he could volunteer at local events or sponsor local businesses and teach them the benefits of chiropractic care.
All right, so let's get through some statistics first. Dr. Bynum's office is located in far north Addison, and he's male. So male chiropractors make an average nationally of about $100,000 per year. In Texas, the median annual salary for a chiropractor is $77,000. Males make a little bit more. And so in his office, if we separate this into a SWOT analysis and we look at the opportunities and the threats, this is actually very favorable. His location is very favorable to be able to reach those numbers because he's in a swath of northern suburbs that are experiencing growth, not just in population, but also financially. So the population of Addison is 15,000 people, and there are 30 chiropractors in that area, 621 in Dallas County, but 30 in Addison. That may seem like there's a lot of competition, but Addison is having population growth. The population is highly educated. The median household income is about $71,000, which compares favorably to Dallas and to the northern suburbs beyond Addison. So overall, there's a business atmosphere and growth opportunities in terms of population.
Despite all the trouble the Texas Medical Association has been giving chiropractic by limiting the scope of practice, Dr. Bynum has still been able to reel in a whole lot of loot, $160K in his first 12 months of opening his practice, as well as After only 2 years of being open in Addison, he's been voted the chiropractor of the year both years. Dr. Bynum has also been working within the community with other providers to make sure that pre and postnatal patients are getting care, and also exercising his privileges by performing all neurologic tests and ortho exams on all his patients. With the background knowledge that the TMA is constantly trying to threaten to take away these privileges. Yeah, the Texas Medical Association has even gone as far as trying to rid chiropractors of terminology like subluxation, or even giving them the rights to diagnose as a whole, or even perform neurologic tests, which is quite absurd.